In Mumbai's largest and most congested slum in Dharavi, cases have jumped by a whopping 2,100%. That's 21 times in just 10 days. 150 fresh cases reported on Friday, taking the total number of active cases to 588. Mumbai's civic body is taking all measures to activate quarantine centres and hospital beds at its disposal.
As COVID cases continue to rise sharply, with the state and the city reporting huge numbers, that impact is being felt in Dharavi as well. Now, Dharavi has a unique problem. Small houses, tenements, where isolation is practically impossible if someone tests positive. So that means that a more number of people have to be institutionally quarantined and perhaps also be sent to the medical facilities available.
In the congested lanes of Dharavi, the virus is racing, up by over 2,100% in just around 10 days. Officials outline the challenges.
On 27 December, there were only 27 active cases in Dharavi. Currently, there are more than 450 active cases in Dharavi. Now, the challenge is to isolate them, because see, there is no question of home isolation, because 80% of people in Dharavi stays in, depends on community toilet, which is being used by several people, and there are hardly 450 community toilets in entire Dharavi.
Mumbai civic body has already asked private hospitals to augment bed capacity to peak levels, which means the maximum number of hospital beds will be available in the city. The BMC commissioner, who had told NDTV that more restrictions would kick in if daily cases crossed 20,000, ordered private hospitals to restore bed capacity to peak levels as it was on 5th May 2021. Private hospitals have also been asked to ensure that there are no direct admissions without intimating ward war rooms. 80% of total COVID-19 beds and 100% COVID ICU beds at private hospitals will be reserved for ward war rooms to allot to COVID patients.
During the wave 2 of COVID, we created close to 160 beds. Out of that, close to 90 beds were there in our one of the facilities, and that is active. And we are in the process of opening up one external center where close to 65 patients can be accommodated. We had a center along with the BMC where we planned for high dependency bed around 20 numbers. So if needed, we'll activate those beds also. But at this juncture, it becomes very important for us to keep our human resources like doctors, nurses safe and secured.
From 27 to nearly 600 in just around 10 days. That's how fast the virus is spreading in Dharavi, Mumbai's most congested slum. But with infections less severe and less hospitalizations, the situation is under control. But as cases rise, the demand for quarantine centers will increase, and that officials say is going to be a challenge in the third wave. In Mumbai, with camera person Ashok Mahadik, Saurabh Gupta, NDTV.